Meaker, and this is my demonstration of the breath technique for overcoming PTSD and other anxiety disorders. In the United States, there are two populations that have the highest risk of developing PTSD, or post-traumatic stress disorder. These are female survivors of domestic violence and veterans that are returning from battlefield situations. According to the U.S. Department of Veteran Affairs, approximately 20% of military personnel returning from Afghanistan and Iraq experience and report their PTSD symptoms. These can include extreme irritability, inability to function, doing normal tasks due to crippling anxiety or flashbacks, substance abuse, which is often a means of self-medicating, and severe nightmares that can lead to sleep deprivation and subsequently further compounds the other symptoms of PTSD. It's also important to remember that this 20% estimate does not take into account the percentage of those veterans that don't report their symptoms or seek help because of the stigma that's often attached to mental health issues in the military culture. As for domestic violence, there's no denying that this is a global pandemic. According to the World Health Organization, between 13 to 52% of women worldwide are victims of domestic violence. On top of this, at least 50% of active duty personnel returning from battlefield deployments like Operation Iraqi Freedom and suffering from PTSD engage in some form of domestic violence against their spouses. In fact, the number of these incidents has risen in direct correlation to the increasing number of veterans returning from Iraq and Afghanistan in recent years. Since greater than 40% of domestic violence survivors develop PTSD as a result of their trauma, it is very important to find effective and safe methods to treat PTSD among returning veterans so that they do not bring the war home and inflict subsequent pain on their family members. I've experienced firsthand what it is like to not only have a husband in the military return from a battlefield deployment suffering from PTSD, but also what it is like to be violently attacked by that same person. Although my husband was taking medication for his symptoms, he still experienced many of the crippling effects of his PTSD, which he didn't seek therapeutic help for because he was afraid of the stigma. So he was going through the irritability, the mood swings, the extreme jumpiness, and the frequent and severe nightmares. When his condition reached the point to where he began physically attacking me with increasing severity, I was in complete denial about what was happening. Eventually, when the final attack put me in the hospital, I knew that not only would I have to learn to move on from that relationship, but I too would have to seek treatment for the increasing anxiety I was experiencing following that brutal attack. Even though I recovered from my injuries really quickly, it took a lot longer to recover emotionally from what I went through. I tried a number of meditation techniques, but it wasn't until my therapist introduced me to imagery exposure that I began to experience less fear and anxiety from my flashbacks and the nightmares, so I was able to start experiencing a normal night's sleep again. And then over time, I began to develop the breath technique so as an easy model to remind me of cue cues to practice during imagery exposure or any time I experienced a flashback or nightmare. Breath stands for base, rate, emotion, anchor, tension, and hope. When I demonstrate the imagery exposure and breath technique, I'll go over the questions related to each letter of the acronym. But briefly, base refers to finding your center and switching to an objective perspective of the situation so that you can begin to implement the other letters of breath. The R for rate refers to the rate of your breathing, which you will want to check to ensure that you're not breathing shallowly or rapidly, since this can enhance your feelings of anxiety or stress. E is for emotions, and this is a cue to make an objective assessment of the emotions and thoughts you're experiencing in the moment that you're having a flashback or in the middle of the imagery exposure. A for anchor is a reminder to recite to yourself an anchoring affirmation, such as, I'm alright, I can get through this, I'm strong. Anything that can help you get a grasp of your emotions. Then you can begin to scan your body for tension and try your best to relax those areas where your body is storing the stress of the experience. Finally, that comes to H for hope. This is where you can focus on thoughts of hope. These can either be recollections of how you have overcome that imagined situation or a similar one in the past, or by optimistic reassurances that you have the capability to overcome it. This can be paired with an assessment of your resilience and your support group. Sometimes it helps if we have a belief that we have the ability to overcome. This is oftentimes referred to as self-efficacy. And it also helps if we know that there are people around us that we can depend on in a time of crisis. If it's an especially painful situation that you are trying to visualize, it's also helpful to tell yourself that you will heal in time and that you are encouraging this healing process by finding the courage to confront your fears in a controlled manner. So before I begin, it's important for me to note before the demonstration that this exercise is not a substitute or replacement for proper medical and psychological treatment for PTSD. Nor should you attempt imagining an extremely fearful or emotionally charged event without the supervision of a mental health treatment provider. If you are experiencing symptoms of post-traumatic stress disorder or trying to recover from a traumatic event, it is best to seek the guidance of a mental health professional and also inform your loved ones of your desire to seek help so that you will have an active support group as you undergo treatment. So for the purposes of this demonstration, I am obviously not going to have us walk through a visualization of something extremely scary, but I will have us visualize a situation that causes a lot of people anxiety, but it shouldn't produce overwhelming panic for you, and that would be speaking in front of a large audience. So first, you'll want to find a room with no distractions. You should turn your phone on silent. You can put on ambient music if you like, but not if you'd be distracted by it. Then you want to sit or lie down in a comfortable position. If you're sitting up, it might help to have some support behind you, if that helps. And then you'll just want to close your eyes. Now you want to try to focus on your breathing first for a few minutes. If you're a beginner in meditation, a lot of people have a tendency to breathe into their chest and pretty quickly. That's not very relaxing at all. So you'll want to breathe in deeply for 3 seconds. Count slowly to 3. Into your abdomen, so you can feel your stomach expanding. So, and exhale by contracting your abdomen gently, and make sure that all the air is out of your lungs before you inhale again. And you want to repeat this cycle a few times until you're in a calm state. Now we're going to imagine that we're in a large stage in front of a large group of people. There are bright lights shining on you, and it's difficult to make out the faces of the people in the crowd. It's really quiet. You can almost hear a pin drop. It's so quiet. And there's no podium in front of you to hide behind. It is just you, the stage, and the crowd. During this visualization, try to focus on imagining any colors, smells, any sounds that might pop up in the room, like a person coughing, or people moving in the audience. When you have the image vivid in your mind, and you can start to begin to feel the anxiety, like butterflies in your stomach, you can start going through the letters of breath. So first, you want to find your base by turning your attention to your body and your thoughts. Make sure that you're keeping the visualization of the situation in your mind very clear, but start turning your focus inward and towards your mental and physical experience of the situation. Then you want to bring your attention to the rate of your breathing. Are you still breathing deeply and slowly, or has your breathing returned to being rapid and shallow? Are you breathing into your abdomen still, or are you noticing your chest is rising and falling? If you answer the latter in both cases, then go back to focusing on your breathing so that you're inhaling deeply for 3 seconds and exhaling 3 seconds. Next, you'll want to become an objective observer of your emotions and thoughts in response to the situation. Are you feeling anxious or upset? Are you sad or angry? What kind of self-talk are you engaging in? Is it encouraging or is it defeating? For instance, are you telling yourself, okay, this will be over soon, I can get through this? Or are you telling yourself, I'm so nervous, I can't get a word out. Everybody's going to think I'm completely inept and incapable, and that's negative self-talk. Don't do that. After acknowledged and assessed your emotional state, then you can apply an anchoring affirmation. For instance, if you were engaging in negative self-talk, like I can't get through this, then you can combat that by saying, I can get through this presentation. If I mess up my speech, I'll just keep going. In fact, nobody will probably notice if I mess up. Or I can get through this. The sooner I start, the sooner I can finish this. And then just repeat these anchoring thoughts until you feel more at ease, while still keeping visualization clear in your mind. It also helps to practice these anchoring affirmations in a controlled environment so that when you're actually experiencing that situation, you know instantly what to tell yourself. Now you can begin scanning your body from head to toe to check for any areas that you are tensing up. So, are you frowning? Are your lips pursed? Are you clenching your jaw? Is your neck tense, or are your shoulders hunched up around your ears? Do you feel tightness across your chest or abdomen? Are your legs tightening up? Are you tapping your foot anxiously? After assessing all of these areas, you can stretch out those muscles, or you can shake them out so that you can relieve the tension and relax your body. So after physically relieving yourself from tension, you can start working towards relieving the mental tension you may be experiencing by focusing on hopeful thoughts. So this can be by visualizing yourself successfully getting through the speech and being met with a round of applause. You can even smile as you're picturing this to have a physiological response to it and trigger, because when you smile, your brain releases endorphins. You can even think back to another instance in which you successfully gave a speech, maybe in front of a smaller audience, but that can help. And once you've completed this, you can open your eyes, take some deep breaths for a few minutes to just maintain the relaxed state before resuming any other activities in your day. Once you have mastered this technique in combination with imagery exposure, you can again apply the breath technique in any situation that is related to the one that you're visualizing in the imagery exposure and that brings you anxiety or stress typically. There's been a lot of interest in seeking non-medicinal methods for treating PTSD among veterans and domestic abuse survivors. Usually Zoloft and Paxil are two antidepressants that are commonly prescribed to patients suffering from PTSD. But the problem is they do lead to a number of side effects, such as headaches, nausea, sleep deprivation, increased agitation, decreased libido, and even increased thoughts of suicide. So due to the potentially dangerous outcomes of taking antidepressants and the potential of them just masking symptoms rather than effectively treating them, many mental health professionals and veteran affairs refer to imagery exposure as one of the most effective therapies for treating PTSD, especially when it's administered in combination with a cognitive processing disorder like the breath technique. With increased awareness of both the symptoms of PTSD as well as the psychotherapeutic methods of treating it, there is hope that survivors like myself and veterans like my husband can find the healing that they need in order to resume a happy and healthy life that's free of fear, which comes as a result of experiencing a traumatic event. Thank you.